Chirp, chirp. Chirp, chirp. McKnight here with Service Dog Academy and Diabetic Alert Dog University. I am coming to you from Florida, actually destined for Walton Beach, Florida. As you can see, I have the most beautiful, gorgeous sunset here on an abandoned beach, and that I'm walking my dog on. And each week I come to you with a socialization item, and this week's socialization item that was kind of thought up by my experience here on the beach is birds. You know, chirp, 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 little birdies. There's a lot of birds on the beach here, and especially if you have a bird dog, it's really important to get your dog out experiencing what it's like to be around birds and not chase them. So really important, get your dog used to birds, because at some point you're going to be maybe going to a museum or someplace, or a aviary or something like that with your children, and you do not want your dog like bursting off and chasing, you know, the $3 million peacock they have in there. So really important, get your dog used to birds, because at some point you're going to be around them and you do not want your dog chasing them. What I do with my pups is I'm just playing the look at me game. So when they look at a bird and they look back at me, they get a treat for it. So if they don't chase it, they get a wonderful treat. And if they do, they actually go in the opposite direction. This week's question is actually a great question. It comes to me from, I don't actually know where, so I'm just gonna tell you that the question was, if you have multiple dogs in your household, can you still train a medical alert dog? This is a really great question, because a lot of the students who come to me think that automatically, because they have another dog in the house, that it means that they can't train a service dog for themselves, and that is actually not true. So the reason why a lot of organizations don't allow you to have a dog in your household when you are being placed with a service dog is because they can't guarantee that your dog is going to not harm their candidate. And that's the reason why most of the programs don't allow you to have another dog in your household. You actually can have a dog in your household and train a medical alert dog. However, there are a few caveats to this. So the first one is, if you have a dog that is aggressive, or dog reactive, or has severe fear and anxiety issues, you definitely don't want to try to place a new puppy in your household while you still have that dog living in your household, because what will happen is dogs learn from each other, and they they mimic each other. So the issue that you're going to have is you're going to have a dog who has never had these experiences of being around another dog, and then all of a sudden they're placed in a new household and they see this other dog completely freaking out when they see people, or completely freaking out when they see another dog. So what happens is they kind of learn that this is what's supposed to happen. When you encounter another dog, you're supposed to be fearful. So if you have a dog in your household that is fearful or anxious or aggressive towards other dogs, I do not recommend that you place another dog in your household and try and train it for medical alert work. However, if you have a nice, calm, 11-year-old Labrador who loves everybody and can't wait to experience, everything in life, and is just a super happy, fun-loving guy, then yes, it is possible that you could place another dog in that household and you will have no problem training your dog. But if you have a dog that's like guarding resources, or that it has a history of biting other dogs, or is aggressive or anything like that, you definitely don't want to try and train another alert dog until you can be sure that your dog will not hurt somebody. And that may mean potentially placing that dog with another household. I know it seems horrible, but the thing is that this decision is based on life or death, and you do not want your new candidate that you spend 6 months to a year training all of a sudden being dropped from your program or dropped from your training because it is reactive to other dogs, or you can't get it to stop guarding food. So again, yes, you can train a dog for medical alert work if you have another dog in your household. However, it depends on the dog and the dog's, issues. So I hope that answers your question. The person who sent it to me, I can't remember what your name is on top of my head. I'm out in the middle of nowhere on a beach and I couldn't remember what your name was. So I hope that answers your question. And again, if you do have questions about medical alert dog training, you can email me at info@servicedogacademy.com and I will try to answer it in the next week's video. If you have questions or comments about this video, please leave it on the YouTube channel or on my website where you're probably going to likely find the video. And if you would like additional information on training your own medical alert dog, you can go to servicedogacademy.com or diabeticalertdoguniversity.com and enroll in our 4-week class, or our 4-day class. And there's one actually coming up here in Miami. And I don't know where the next one will be soon, but as soon as I know about it, if you get on the email list, you'll be notified about it. So again, I hope you're having a good Christmas and New Year, and I'm looking forward to helping you train your own medical alert dog in a beautiful sunset like this. So see you next week, you guys. Good luck.